Good afternoon, everybody, and welcome. Thank you so much for taking some time to spend with us here today. It is my distinct pleasure to introduce Christine Nadolski, who's here to talk to us today about a benefit that, a resource that may be of tremendous help to you and to your law firm. So we have Christine Nadolski here from Professional Insurance Program, and she's here to talk to us a bit about the group health plan that we have are working with PIP to offer for law firms. And Christine, welcome so much to this Wisconsin Solo and Small Firm Conference. It's great to have you with us again. I think we had you with us a couple of years ago.
You did. Thank you so much, Barbara. I appreciate the introduction. I appreciate the opportunity to speak to bar members as well. Today, we're actually going to be exploring your exclusive State Bar of Wisconsin Association health plan benefits for small law firms, large law firms as well. The association group health plan was actually established in 2020. And this was specifically for our Wisconsin State Bar members. The goal of this program is actually to create large group pricing for small firms. By doing so, we can actually take advantage of large group pricing. So with that, let's get into our program and shout out to the Packers. Sorry, I had to put that in there. And if you're not a Packer fan, sorry, but it was a very good game and I'm a little tired today from it. So again, hello and welcome. I am Christine Nadolski, the team lead benefit manager, and I'm here and I'm going to go through our agenda today. Our agenda is actually, we're going to be overviewing the plan types and common terms, plan designs within the program, benefits of the plan, and value adds, and how do you get a quote. The types of plans that the association offers, there are two different types of plans. One is a traditional copay plan and the high deductible health plan. The copay plan is actually more a traditional type plan that you have a predetermined amount that you're going to pay for services when you go to the doctor. So your primary care provider is going to be a $25 copay. Your specialist would be a $50 copay. These plans tend to have a little bit of a higher premium because of those upfront benefits that are encased in that program prior to the deductible being satisfied. We also have, like I mentioned, the high deductible health plan. They used to be called health savings accounts, and they were confused with the actual health savings account that you can put money in. So they changed the name to the high deductible health plan, or an HDHP plan. As the name suggests, it is a higher deductible health plan that you must meet that deductible prior to the insurance actually paying its share for labs, tests, prescriptions, and what have you. These premium costs actually do vary, but the high deductible health plans actually tend to be a little bit more cost efficient. Now, with both of these plans, please keep in mind that preventative services are, if in network, will be covered at 100%. So there is no cost to you on your preventative services. Some of the terms that you will need to know and keep in mind, and again, this may be a refresher for some of you, is the deductible and the coinsurance. The deductible is actually how much you pay for your health insurance before, or I should say for your medical coverage before your health insurance starts to kick in a larger portion of your bills. Your deductible, regardless of when your renewal is, will actually reset yearly. So every January 1st, your deductible will reset for the following year. Does not matter when your plan renews. So if you have a June renewal, your deductible will automatically reset on January 1st. Coinsurance is another somewhat confusing term. It's actually a percentage or a cost share of medical charge that you pay, with the rest being paid by your health plan. Typically, it applies after your deductible has been met. Most of our plans are actually a 80-20 coinsurance. What this means is that any services that go to the coinsurance, the carrier will pay 20 or 80%, and you are responsible for that cost share of 20%. Now, we do have plans that have 100% coinsurance, so it's either 80 or 100 with our association plans. And speaking of our plans, here are our plan designs for the association group health insurance. We do have 5 copay plans, and as I mentioned, they have a primary care provider copay of $25 and a specialist copay of $50. Now, if you don't know if it's going to be a specialist, think of anything that ends in an IST. So your dermatologist is going to be your specialist at a copay of $50. So we start at a $750 or $750 deductible, and it ranges all the way up to a $5,000 deductible. And here's where I mentioned we have a 20% coinsurance or a 100% coinsurance. The $5,000 does have that option of 100%. The HSA qualified high deductible health plans will allow you to establish an HSA account to help pay for medical expenses on or off the policy. We do have lists available that we can certainly provide you for eligible expenses that are most likely off of the policy, but these plans start at a $2,500 deductible and go up to a $6,550 deductible. When we're looking at these deductibles, please keep in mind that these are all the individual deductibles. Your family deductible will be 2 times what you're seeing on the screen. Now, we do have non-embedded deductibles for the $2,500 deductible. If an employee has family coverage, the family deductible must be met before the plan pays any benefits. So I wanted to just kind of bring that up so then that way we kind of differentiate the embedded and non-embedded, and it also is within our flyer as well. Benefits of the plan selection. You can actually elect up to 4 different plans within WPS for your firm, Now, obviously, we want to make sure that we have an employee in each one of the options that is selected. They will not have an open selection with no employees in it. But if you have somebody who has the needs of wanting a lower deductible and the copay amounts because they just can't satisfy that large deductible for a HDHP or high deductible health plan, we can have those individuals in the copay and say, if somebody says, nope, I only go in for preventative, that's all I need, that's all I want. Those high deductible health plans are perfect for that. They will go through the network for repricing any services, but you are able to kind of monitor your services and know exactly what you're going to be paying out of pocket because of that high deductible health plan. So this gives that flexibility, like I said, for selecting plans for yourself and or for your family. With the Affordable Care Act plans that are out there, employer contribution is at a minimum of 50%. And that's for the single employee. Some small firms may not be able to do that. So when we created these plans, we eliminated that responsibility for the employer. And the employer can actually elect the contribution level for all of its employees, or say, you know what? If you want the plan, it's 100% you who are going to be paying the premium. So then you do a pre-tax deduction from their payroll, because the employers will still be billed for that plan. Again, we do suggest at least 50% of the single premium. We're trying to add value to the firm and our employees and know that they are valued by us as well. This gives, again, the employer the freedom to contribute what they would like and kind of customize their plan for themselves and for their firm. Another aspect of it, which sometimes is a hindrance, is that full-time employee equivalent of 30 hours or more to be considered full-time. On the Affordable Care Act plans, you have to work a minimum of 30 hours. We know that smaller firms may not have employees that work a 30 or 37 and a half or 40-hour week. They may only work 26, between that 26 and 30 range. Well, when we created this, we wanted to make this available to people who weren't quite up to that 30-hour mark. So our full-time requirement in WPS is actually 26 hours. So we reduced that. Again, if your employee handbook states that your full-time hours are 30 or more, that will certainly supersede this requirement. We have a lot of customer resources with WPS. Once you are enrolled in the plan, you have convenient access to online tools and resources. You can look at your claims, you can look at your EOBs if you need those for anything. There is access to health and wellness information as well. So that's a wonderful library that they do have. Again, lots of information on the website, but register once you are actually enrolled, because you'll be surprised on how much is actually out there. I had to grab an EOB for our third-party administrator, and I was dumbfounded. I registered, but I never went out there and really accessed that information. And it'll tell you how much of your deductible you've already met, in and out of network. So definitely take advantage of that once you're enrolled. Prescription drug coverage. With these plans, we actually have a zero copay on selective preventative drugs. The most common: cholesterol, high blood pressure, anxiety type prescriptions, you can get at a zero cost to you because of this $0 copay. Again, I mentioned preventative services. WPS will pay benefits without any cost sharing when you receive care from an in-network provider. Now, this could be your routine immunizations, routine medical exams, including routine diagnostic services, well child care, mammograms, and preventative screenings. So if you don't go to the doctor, at least you can get these preventative services that will hopefully give you a clean bill of health. But if there is something underlying, that's where you want to catch it, because being aware of your medical conditions and getting treatment will help prevent chronic illness, and then again, keep your claims lower and hopefully your renewals lower as well. There are no cost added values within the WPS program. An exercise reward program actually awards you $30 each month for visiting a fitness club 10 times or more within that month. Again, there is some type of documentation, record keeping that needs to be done in order to submit to WPS for that reward. And you work out, you might as well get rewarded for it. Definitely. We also have an Active and Fit Direct program. This offers discounts on 16,000 plus standard and premium fitness memberships. So again, if you are thinking about, well, I really like to get back into the gym, I'm not quite sure, this is a perfect way to do it. Definitely take advantage of that. I know when COVID hit, it was kind of like I signed up for a gym membership, COVID hit, I didn't go to the gym, and now I'm going to unfortunately cancel because it's just, there's no time. And but working out at home definitely is something that I will do. Telehealth services from Teladoc. You hear so much about telemedicine these days, and it is the most convenient way to visit a doctor, especially if you are sick and you don't want to go into the doctor's office or you cannot get an appointment. This actually gives you 24/7, 365 access to U.S. board certified doctors throughout the convenience of a phone call, a video, or mobile app visits. All you have to do is dial them up, and they will go through for general medical, mental health services, and dermatology. So that is something that, if you're sick, obviously you don't want to wait to go to the doctor, and God forbid, you don't want to go into a doctor's office. So telemedicine gives you that convenience of being able to stay at home and get your general medicine from a board certified doctor. They can call in prescriptions as well for you if you need. Something new for WPS that they added this year is actually the pulmonary care program. And this addresses the asthma and COPD challenges. It helps control asthma or COPD with sensors that actually attach to the inhalers and monitor your medication use. There's a propeller inhaler sensor and also an app. Too many times we want to make sure that you're taking the right amount of medication and don't want to overuse it. So this is something that will definitely help monitor that for you. Again, some more added no cost values, the iMed Vision Care discount program, and personal story, had gone to one of the local stores to get my eyes checked, and he went, and I said, I have WPS. I showed him my card, and he went and added up all of the discounts that were available to me. And again, it is a discount program, but not actual insurance. So provider network includes Lens Crafters, Pearl Vision, Target Optical, and many more. There's a 35% off of your retail frames, and then 15% off of your retail price for contact lenses. Another program is Here in America Hearing Plans. This gives you a free annual hearing screen, and then up to 70% off of MSRP. So many people, like myself, back in the day, going to concerts, and I know my hearing isn't as well as it should be. So get those hearing screens. Hearing sight, definitely want to make sure that you're taking care of that, that as well. Now, again, we want to ease this quoting process for you. So ask, how do you get a quote? You don't have to wait till an open enrollment period. You can actually establish a group plan at any time. So if your renewal is June, July, anytime, we can actually establish a group plan for you. Now, the individual open enrollment timeframe runs November 1st, and it's extended until January 15th this year. So that is only for individual policies that you can get on or off of the marketplace. We are, again, the exclusive agency for the association group health plans. And how you get a quote, you fill out a census, and we will then run your preliminary rates. Now, I caution you because the preliminary rates will be generated off of your census information. Unlike the Affordable Care Act plans, the association plans are under the large group umbrella. So these rates are going to be composite or blended rated. So it takes the combination of everyone who's on that census and puts them together to come up with these preliminary rates. If there's changes in that census, your preliminary rates will change. So we always say, if you know who's going to be looking for the coverage, put them on the census. So we have more of an accurate preliminary rate. Again, our rates are composite rated underneath the large group, which actually helps out more of the mature individual, because you're getting a single rate, where if it was age rated, your rate could be astronomical compared to some of the single preliminary rates that we have. Once we have the preliminary rates, we send those off to you so you can review those, and we will answer all questions that you do have. If you feel that, yes, I want to go for these final rates, we will need to have employee applications completed, any waivers for individuals who are declining the coverage, and then also a quarterly wage and tax. And this is, again, so WPS can say, yes, this is a true entity. Once we get all of that information back, we forward it on to underwriting so they can review all of the material that they have. We'll also ask you what type of plan type that you're looking to go for, or plan types. So then that way underwriting can forward the final rates once they are done with their review. Once we get final rates, we forward them back to you for your review and have any conversations that we need. And if it looks good, then we forward you the employer application. You sign the rate sheets and complete the employer application, send it back, and voila, you have a group plan in place for the first of the month of when you want to have that plan established. So it is a very streamlined process that we have. So we try to make it as easy as possible for you. So with that, if you want to get a quote, you can actually visit our website at info@profinspro.com. Visit our website at www.insuranceformembers.com, or give us a call at 800-637-4676. And we'd be more than happy to work with you and make sure that we are providing you with those preliminary rates. Again, I want to thank you for taking time out today. And if there are any questions, Barbara, I will take those now.
Yes, we actually have two. So thank you. And then, we actually, for everybody watching, we do have a moment or two. If you still have questions, please bring them in. The first one, you talked a little bit about telemedicine, but before that, you had talked a little bit about the credit for working out. And somebody's asking, what about people who have remote fitness club memberships right now, where you work out kind of online? Can that be documented somehow and included in that discount?
That's a very good question. And that's what I should have done, is done the remote working out instead of not going at all. I believe so. And what I can do, I can certainly find out and get that information to Annette as well. But I believe that with the onset of COVID, that obviously things have changed on how we process and how we go about our life, that you can document your online or remote workout. And I don't exactly know how you would do that, but I will find out for sure from WPS. So then that way I'm not telling any lies.
I know that like group fitness classes, they do take attendance, certainly, because they are billing people for attending. So
exactly.
Yeah, so
exactly.
I'm sure there are some mechanisms in place. The next question is, how long does this whole process sort of generally take for a really small firm of like maybe 7 or fewer people?
Not a problem. And that's a very good question, because, sometimes it just seems to, on certain programs, it just seems to extend out. It really doesn't take that long. Once we get a census form, we will turn around a quote the same day to you. And again, review that quote. It really comes down to it is, how long does it take to review the quote and get the applications and the waivers? That's really what kind of holds up some of our groups from getting the effective date that they want, because I know people are everywhere. So essentially, we have people who actually ask for quotes and coverage probably like 2 weeks prior to the effective date, and we can do it. So underwriting does not take that long. Again, get it in earlier than later, because as we know, fourth quarter, those underwriters are underneath their desks on piles of paperwork and emails. So the sooner you can do it, the better, because we obviously want to make sure that individuals have their cards in hand prior to their effective date. We're very close to it. We've had some that kind of extended out a little bit into the middle of the week after an effective date. They still will have coverage as of the first of the month, and we do have a letter, an approval letter that normally goes out that they can use as proof that they have coverage until those ID cards are generated and sent out. But it really doesn't take that long. I would say at the most, maybe 2 weeks at the most. But again, getting that information from your employees is probably the hardest thing of all.
And then finally, we have a couple of questions about providers. If you could talk a little bit about what provider networks you work with, and then also what happens if for individuals who maybe have more complicated medical issues and would like to explore other options, such as like the Mayo Clinic.
Not a problem. With our providers with WPS, we have 2 different options. We have WPS Health Insurance and we have WPS Health Plan. WPS Health Plan used to be Arise. Some people might be a little bit more familiar with that name, but WPS Health Insurance is the statewide network. So that provider saturation is about 98% of all Wisconsin providers. We always say, make sure to check your providers within the network, or we can do that as well for you to make sure they are in network. But it encompasses all of your Auroras, Theta Care, Freighter, Ascension, ProHealth, UW, Mercer. So a lot of the larger UW, a lot of the larger providers, in addition to the smaller providers as well. WPS Health Plan is the Ascension, Aurora, the Bellin, the Theta Care. So it is a narrower network, thus the premiums are a little bit adjusted, a little bit less because of the narrower network. Both carriers will have, or both plans will actually have out of network or out of state providers through First Health Network, which is huge. It's huge. So if you're on vacation, don't worry, you have coverage if something happens. In North Dakota, South Dakota, and Minnesota, they have the Preferred One network. So really, we are covered from coast to coast, which is wonderful. And again, that First Health Network is everywhere. So it really does help when you're going on vacation to, look it up on your phone and make sure you get the cough, you get the sniffles with the small children. We want to make sure that they're okay and they're being taken care of. Any emergency situations, say life or limb, will be covered as in-network regardless of where you are, as long as the provider codes it as an emergency situation. So rest assured, emergency anywhere is going to be covered in network, and then you have your extensive network wraps as well. So,
and we have one final question. Do you have any data on how much law firms are experiencing a cost savings by switching to the group health plan?
Well, it really depends on what they're currently offering. Having the large group, and depending on, again, that census information, groups from 2 to 9 actually have a 15% discount already calculated within that rate calculator that we use. So, and again, we're, with the law firms, we're seeing a percentage, maybe 5, it's hard to say. I apologize. But again, depending on what they currently have, we can really custom fit these plans and put somebody in the different options to provide that custom care. And sometimes when you're a smaller firm, sometimes companies don't allow you to have up to 4 different plans, especially if there's only 4 people. They kind of limit it at 2 plans. So I think the value more so is in the coverage that you're able to offer your employees or yourself, definitely.
Very good. We don't have any additional questions, but thank you so much for taking the time to speak with us today. And certainly on this slide, your contact information is there. And anybody watching this, either with us now or perhaps on a webcast replay, that is how you will get a hold of Christine to have any additional follow-up questions.
Not a problem. And the PDFs are available as well. So any of the value add that I had talked about, like the savings with the gym and the teledoc and all of that is available as well. So
thank you so much.
Thank you. I appreciate it. You guys have a wonderful day. And thank you again for tuning in. Questions, feel free to contact us. We're more than happy to assist you.